Hello, everybody.
Hello.
Okay. First of all, thank you so much for inviting me to give you a talk on cardiology masters. I usually visit Cyprus, Turkey, British Medical Association as a visiting professor. In Cyprus and Turkey, I speak in Turkish. To British Medical Association, because they're all foreigners, I speak in English. Turkish schools, Turkish, but I don't understand why for the engineers who are you're all Turkish speaking, I have to speak to you in English. I feel it different, but I will try my best, okay?
You choose, you can do half-half.
Okay, biraz da Türkçe, biraz you're recording it, that's why I didn't want to change it. Anyway, today is a big topic, so I'll try to shorten it. So in my speech today, I'll talk about the anatomy of the heart and physiology of the heart, because without going back to elementary school and showing you what we have to know about anatomy of the heart and physiology, we won't learn anything. So we'll be talking about them and list of types of heart disease, factors affecting the heart, blood pressure, diabetes, fat and cholesterol, smoking, and drug treatment. Well, we associate love with heart, but the heart is not romantic at all. It is just a pump. Brain does all the love work, so in future, in Valentine, you should put the brain, not the heart. Okay, structure of the heart, I'll show you them in a minute. Heart is the size of our wrist, okay? Blood flows through these chambers to the veins and arteries, and blood is pumped into the circulation system, which supply oxygen and nutrients to the tissues from the left side, and removes carbon dioxide and other waste products when the blood flows from right side to the pulmonary arteries, which I'll talk to you later about as well. Somebody's coming as well. So, as I explained to you, this is our heart. The heart is, as you can see, hollow muscular blood pump, which you can see from the picture as well. Okay, if you I open that, you can see the valves here and in the picture as well. So the heart is a hollow muscular pump consisting mainly of myocardium, a type of muscle that works without resting. It is made of the strongest muscle fibers that last a lifetime, providing we look after it. The heart is divided into two halves. I'll try to show this. Left side and right side. So you can always say we have two pumps, right on the right side and the left side. The heart is divided into two halves. Each consists of upper chambers on the left and the right. They're called atrium, and lower chambers called ventricles. And they're connected by valves. Can you see the valve here? Valves are one way. Therefore, blood flows through the chambers. Can you see me?
This red dot doesn't show on the screen. Maybe you can use the hand.
Okay.
This mouse, yeah?
No problem, okay. Right. Therefore, blood flows through these chambers is controlled by one-way valves, which you can see on the diagram. Blood is pumped into the circulation system, which supply oxygen and nutrients to the tissues and removes carbon dioxide and other waste products. So I'll go to the next picture. So we can tell that the heart is functioning with two properties. Okay, we go to the heart rate. As we all know, how many times heart pumps. So in 1 minute, heart rate is 75 on average, of course. Some is 70, some is 80. So I will put average 75, 1 minute. In 1 hour, 4,500 times. In 1 day, 108,000. In 1 month, 3,240,000. And in 1 year, about 39 million. Well, cardiac muscle is a striated muscle that is present only in the heart. And the cardiac muscle fibers have single nucleus. They are branched, as you can see in the picture, and joined to one another by intercalated discs that contain gap junctions. You can see there my finger, no? Can you see it? No, it doesn't matter. And joined to one another by intercalated disc that contain gap functions for depolarization between cells. And there's muscles on top to hold fibers together when the heart contracts. So, heart has got two-type electrical system. One has its own independent system, independent from brain or anybody else. It's their own electrical system, and also nerve supply from the central nervous system. So you can see it. This is called intrinsic or own independent nerve supply of the heart. People think these are arteries. They are not. They are nodes. And excuse me. So heart is independent and it has its own electrical system. So heart rate depends on the action potentials produced by the SA node, which you can see on top on the left hand side. Okay. Which is called SA node or sinoarterial node, known as the pacemaker of the artery. At rest, heart rate is between 60 to 90 per minute, but in athletes, they have a slower heart rate, between 55 to 65, not more than 70. The second node, synovial artery, is a specialized myocardial structure that initiates the electrical impulses, action potentials to stimulate contractions. SA is found in the arterial wall, as you can see it, at the junction of the superior coronary canal and the great and the right atrium. So the pointer doesn't show, but doesn't matter. Okay. So to summarize my video, I always did engineer, so I'm going to call Esin to summarize what I just told you so that you know how the heart functions.
Your heart is a pump. It's a muscular organ about the size of your fist and is located slightly left of center in your chest. Your heart is divided into the right and left side. The division protects oxygen-rich blood from mixing with oxygen-poor blood. Together, your heart and blood vessels comprise your cardiovascular system, which circulates blood and oxygen around your body. In fact, your heart pumps about 5 quarts of blood every minute, and it beats about 100,000 times in one day. That's about 35 million times in a year. Oxygen-poor blood, blue blood, returns to the heart after circulating through your body. The right side of the heart, composed of the right atrium and ventricle, collects and pumps the blood to the lungs through the pulmonary arteries. The lungs refresh the blood with a new supply of oxygen, making it turn red. Oxygen-rich blood, red blood, then enters the left side of the heart, composed of the left atrium and ventricle, and is pumped through the aorta to the body to supply tissues with oxygen. 4 valves within your heart keep your blood moving the right way. The tricuspid, mitral, pulmonary, and aortic valves work like gates on a fence. They open only one way and only when pushed on. Each valve opens and closes once per heartbeat, or about once every second. A beating heart contracts and relaxes. Contraction is called systole, and relaxing is called diastole. During systole, your ventricles contract, forcing blood into the vessels going to your lungs and body, much like ketchup being forced out of a squeeze bottle. The right ventricle contracts a little bit before the left ventricle does. Your ventricles then relax during diastole and are filled with blood coming from the upper chambers, the left and right atria. Then the cycle starts over again. Your heart is nourished by blood too, Blood vessels called coronary arteries extend over the surface of your heart and branch into smaller capillaries. Here you can see just the network of blood vessels that feed your heart with oxygen-rich blood. Your heart also has electrical wiring, which keeps it beating. Electrical impulses begin high in the right atrium and travel through specialized pathways to the ventricles, delivering the signal to pump. The conduction system keeps your heart beating in a coordinated and normal rhythm, which in turn keeps blood circulating. The continuous exchange of oxygen-rich blood with oxygen-poor blood is what keeps you alive.
Now you see this, okay? Now, although heart is dependent and has its own electrical system for contractions, it gets extra help for the regulation of the heart rate from brain directly and from the spinal cord. So there are two types of nerves from central nervous system. One of them is called parasympathetic nerve from brain, branch of the vagus nerve, and this slows down the heart rate. The nerve endings here, it produces a transmitter called acetylcholine, which acts on the muscarinic receptors on the heavy muscle, on the heart muscle. The sympathetic nerves, on the other hand, they come from the thoracic spinal area, from the back. These to speed up action potentials, thus increases the heart rate. These nerve endings produce noradrenaline. We always call it adrenaline, but in fact it is noradrenaline, and act on the beta receptors of the heart muscles. Because of the intrinsic or independent system, the heart continues to beat even after brain death. Or after being removed from the body, the heart will keep beating or pumping as long as it has oxygen and the essential nutrient supply. Now, like any other organ, heart also has its own blood supply. When I tell this to the children in schools, they said to me, all the blood goes into the heart. How come it needs extra blood vessels? Well, this is the answer I give them. Does your mother or father work in the bank? Yes. And do they take money every time they come from the bank full of a suitcase? No, they get monthly payment. I said the same system. You have the money in the bank, all the money in there, but you can't take it. Same here, because the blood vessels, I'm going to tell you in a minute, they have a special membrane, very thin membrane inside, that exchange occurs. If you have the same system inside the heart, then because so much pressure, it will traumatize the whole heart. This is what we have two arteries called coronary arteries, which both come aorta. Simply, the one comes from the left is called left coronary artery. One on the right is called right coronary artery. The left one divides into two. One goes circumflex, which provides the blood to the posterior part or the back of the heart, and the left and the left anterior descending artery, which is branch of the left coronary artery, supplies the blood to the bottom of the heart. And as you notice, as the vessels come down or towards the ventricle, towards the bottom of the heart, they get narrower, narrower, and narrower. Now, the right side, it also divides into a few branches. Some supply the blood to the atrium chamber, the one above, and the other parts to the anterior part of the right ventricle. Now, I want to say a few words about things. Muscle fibers can be exhausted if they don't receive enough oxygen or nutrient, i.e., if you are an athlete and you run a lot, and even football players, after so many miles, they get cramps. What is a cramp? Cramp is the spasm of the blood supply, blood arteries. Therefore, no oxygen, no energy no sugar, goes into the muscles. So it contracts. There's continuous contraction. So the reason I'm explaining to this cramp, and we talk about angina. What is angina? Angina is a cramp of the muscles, of the cardiac muscles as well. And usually it happens at the bottom of the heart where the artery is very narrow. And if it gets blocked slowly, we call ischemic heart disease, or it doesn't supply enough blood, which I'm going to talk to you about atherosclerosis and blockage. So what happens if you run and you don't have enough blood supply? Muscle fibers become exhausted, not receiving enough oxygen or nutrient. So what happens when you use oxygen and when you use sugar, in the end you get energy and toxic stuff, toxic materials. These toxic materials are removed by the veins. But because of the poor circulation as we get older or due to atherosclerosis, this affects these products, accumulates, and if not removed fast enough, we call spasm or angina. Angina is temporary. So what do we tell patients? If you're running or walking and you got angina, spasm or cramp of your heart, then sit down, slow down. You will see that gradually the blood supply will be sufficient, you'll get better. Or we can give them a medicine which we put under the tongue, which dilates blood vessels. So angina simply means cramp, just like you get muscle cramp somewhere else. Anyway, I just wanted to talk about all those things, which is very important. So what's the next one? Okay, we now talk about the structure of the blood vessels. Each vessel has got 3 layers. Unfortunately, this is not working, so we have to imagine. Look at the left side first. They have internal layer, which is a very thin layer, and it's called medial layer, which is muscular, and external layer, 3 layers. The internal layer is called endothelial layer, which is a very thin layer. I'll show you. Here we are. This is the inside of the, can I use a pointer? I don't know. If I go like this, can you see it? No? Okay. All right. So inside you have a very thin layer of epithelial cells, and oxygen or nutrients or toxic materials or medicine can pass into the muscle layer, which is thicker. This muscle layer is much thicker and stronger in the arteries and weaker in the veins. Now you can see the cross-section of the artery, and it is firm and it's very strong. But when it comes to the veins, can you see about that? But there's a vein and artery there. Vein is flexible because it has less muscle. So, am I losing you so far? No. Okay. Now, here I'm showing you the capillary system. Blood vessels get smaller, smaller, and smaller. And what happens in the end? Blood is more or less like in a field. So that's where in lung, this is what happens, and in kidneys, this is what happens. So what you get is exchange of gases in the lungs, and also certain parts of the body. We still have these capillaries. Well, there's a connection between artery and vein. Can you see it? Artery is on the left, and the vein is on the right hand side, and vein and artery exchanges oxygen from the artery. So, what's the next one? It's not working? What's happening? It's not working now because of that. Sorry, we have technical problems. It's not changing. Move that out. Huh? I'll talk. Just move that one out. How engineers help. I don't want the mouse. Just get out.
Okay.
Get this out.
Okay.
Okay. Nice working. Okay. Engineer tried to help me, but it made it worse. Okay. Now, what sort of heart has diseases? Plenty. We can be here all day, but I'll only talk on few today. There are many types of heart disease that affect parts of the organ and occurs in different ways. The most common are congenital heart disease, which we usually recognize them at birth, arrhythmias as we get older, coronary artery disease, which I'll talk in a minute, dilated cardiomyopathy, means heart gets bigger from congestion or from increase in sugar and increase in water, myocardial infarctions due to ischemia, due to not enough blood going through vessels, heart failure, and hypertrophic cardiomyopathy. That means enlargement of the heart. This is very common among people who do heavy weightlifting. When you do heavy weightlifting and take certain hormones as well, your muscles get bigger. But at the same time, your heart muscles get bigger as well, and they don't live very long, weightlifting people and doing heavy weightlifting. So I tell people exercise, swimming, walking is better than using heavy weightlifting. And also valve regulation, problems of the valves. That's also a big topic. Usually when we talk to the doctors on 1 hour, we only talk either hypertension or valve disease or arrhythmia. But today I was asked by the boss to say a few words about everything. Formation of the atherosclerosis it's many factors. It's many factors, but as you can see from there, can you read it? I don't know, but it shows there that factors affecting the heart as and atherosclerosis, age. As we get older, it's unavoidable. They get old. And second is hypertension. Okay, age, hypertension, diabetes, lack of exercise. You're going to say, why are those three in red? Because those three are the most important factors in atherosclerosis and heart disease. So I'll repeat again. Hypertension, which means high blood pressure, diabetes, lack of exercise, the smoking and drug abuse, obesity, cholesterol, increasing cholesterol levels, genetic factors, lifestyle stress problems, and alcohol. So as I said, those three are the most important. So I'm going to talk about, first of all, blood pressure. Blood pressure is measured in millimeters of mercury, measured by sphygmomanometer, which is wrapped around the upper arm over the brachial artery. And blood pressure is given as two figures, systolic pressure and diastolic pressure, which you have seen it in the video as well. So this is one of the manometers, sphygmomanometers, electrical, often wrong. And also, if you notice, people also put it upside down on the arm. Brachial nerve is at the point where your elbow is flexible. But this one, these are the best. The mercury ones, which are not electrical, but of course manual, are the best. And the cuff is put exactly on the brachial artery where it should be. And these are the most accurate one, which doctors has used it. Use a stethoscope at the same time and also listen to the heart sounds. Now, systolic pressure, each ventricle, when contracts, they forcibly eject 70 ml of blood into the blood vessels. And the pressure is the highest at this contraction, called systolic blood pressure. Diastolic pressure, on the other hand, is lowest when heart is relaxing, i.e. it is the pressure when the heart rests between beats. For example, if your blood pressure is 140/90, it means that you have a systolic pressure of 140 and the diastolic pressure of 90. Now, having a raised blood pressure reading in one test does not necessarily mean you have a high blood pressure. So blood pressure can fluctuate throughout the day. Feeling anxious or stressed when you visit your GP or when I see my wife, can also raise your blood pressure. When you go to the GP and increase your blood pressure or the hospital, we call this white coat syndrome, and this is very true. So if you have a high reading, you may be asked to take some readings at home with blood pressure monitor, or wear a 24-hour monitor that checks your blood pressure throughout the day. This will confirm whether you have consistently high blood pressure, and this is known as 24-hour ambulatory blood pressure monitoring. Now, arteries have elasticity property. Sorry, I can't show you with the pointer, but as you can see in the artery, every time blood pumps, pressure increases in every direction. If you notice, the arteries have elasticity properties or ability to expand and dilate, especially near the heart. The expansion and subsequent relaxation of the wall or the radial artery can be felt as the pulse at the wrist, which is, as mentioned a few minutes ago, it was 75 minutes per minute. So in each pump, these arteries dilate and then goes back to normal. Dilate, goes back to normal, which we call the pulse. A great increase in the blood pressure can result if these walls lose some of their elasticity, which occurs with age or with a disease, and can no longer stretch readily to accommodate so much pressure and so much of the heart output during systole. So, known causes of high blood pressure. I think this is very important that we should talk about as well. Okay, as you can see from the diagram, in about 1 in 20 cases, high blood pressure happens as a result of an underlying health condition or taking certain medicine. Health conditions that can occur, high blood pressure, include, as you can see, kidney disease, diabetes, long-term kidney infections, obstructive sleep apnea, where the walls of the throat relax and narrow during sleep, interrupting normal breathing. What it does when you still got less, and then when your wife thinks you're dying and they're happy, but you come back again, you don't die. That's called sleep apnea. Okay, so after that we come to glomerulonephritis. Okay, what is glomerulonephritis? If the kidney has damage to the tiny filters inside of the kidneys, it's called glomerulonephritis. And also, if the blood supply to the renal, to the kidneys, i.e. narrowing of the arteries supplying the kidneys, can also cause increase in blood pressure. Also, hormone problems such as underactive thyroid, we call hypothyroid, or overactive thyroid, Cushing syndrome, acromegaly, increased levels of hormone aldosterone, and also pheochromocytoma. What's chromocytoma? These are little tumors on top of the kidneys in adrenal glands, and they produce adrenaline. And of course, we know adrenaline constricts the blood vessels and causes increase in blood pressure. Lupus, a condition in which the immune system attacks part of the body, such as the skin, joints, and organ, like rheumatoid arthritis. And scleroderma, a condition that causes thickened skin and sometimes problems with organs and blood. Too much salt intake that also causes blood pressure. Okay, so much about that section. Now we go to the medicine. Okay, medicine that can increase your blood pressure includes contraceptive pill, steroids that we use for rheumatoid arthritis and asthma. But some people use certain type of steroids to increase their muscle, and that also can cause blood pressure. Non-steroidal anti-inflammatory drugs, such as ibuprofen, or sometimes called Nurofen, and naproxen. Some pharmacy cough and cold remedies, some herbal remedies, particularly those containing licorice, some recreational drugs, such as cocaine and amphetamine, and also cannabis. Some antidepressants, like some of them are called selective serotonin noradrenaline reuptake inhibitor, SSNRI, and other antidepressants such as venlafaxine or Cipralex. In these cases, your blood pressure may return to normal once you stop the medicine or drug. What do we have next? Okay, so when we talked about the blood pressure, in the old days, we used to say, how old are you? 60. So 60 plus 100, we used to say 160 upper limit is normal. If your age was 70, 170 was considered to be normal, but things have changed. But among this blood pressure, most important thing is the diastolic pressure. It shouldn't go above 90. I mean, 90 is a limit for everybody. Okay, let's start with the low blood pressure. We talk about high blood pressure, but low blood pressure is also more dangerous than high blood pressure because you faint. Blood doesn't go to your brain. So it's lower than 90, in between 90 and 60. Does it happen? Yes. Some people, if they stand too long, like Queen's Guards upon a time, they used to stand straight in front of the Buckingham Palace for up to 6 to 7 hours, and they weren't allowed to walk. They used to drop and faint. And they realized that if you stand too long, then blood pressure comes down because you have baroreceptors on your neck here, by the carotid. If you get up or stand up, it regulates the blood pressure. And if you stand too long like this, blood pressure goes down, and also you faint. Now, once upon a time, they were trying to bring giraffes from Africa because they are so tall. They put them on the lower deck and put their heads up just to eat, and they all died. You know why? Because they have such a long neck, and they need high blood pressure to push the blood up to their brain. So because they couldn't bend down, if you notice, you go to zoo, I'm sure that you go to zoo, you'll watch the giraffes, they keep bend down every few minutes. They bend down, and why do they bend? So the blood goes to their brain. So blood pressure also helps for the circulation. So giraffes, they bend each time to bring their circulation and blood pressure up, and they don't faint. So at the moment, what they say, the best blood pressure for young people is 120/80, means 120 systolic and 80. But also this varies if you have obesity or you have some problems. And also on average now, it's called, we don't treat anybody under 140 or under 90. So limit is 140 and 90, but for elderly people over 50 and 60, then we're allowed to have the systolic pressure up to 150 and 90, as long as they don't have any other medical problems. Okay, so far about medicine and blood pressure. Now we should come to diabetes, which is the most important. Okay, diabetes is the main cause of most cardiovascular disease, and it is also the main cause of atherosclerosis, i.e. blockage of the arteries. So here we are, we can show something. What are the blockage? It is multifactor. If you can see the heart and the normal blood vessels on the left, and with atherosclerosis, when you have it, it's got plenty component, many other things that cause atherosclerosis. It's not only fat or salt or some and other things. It's multifactor. If you can see it, normal coronary heart, gradually it gets blocked. We call this atherosclerosis, and as it gets worse, complete block, and you have hardly any blood supply. So I think these are enough. You got the idea now that you got, just like you water in the garden, and if it's blockage in your hose pipe, then you can only get water. Same thing with arteries. And the worst ones are the small arteries, which are found in the heart, mainly in the ventricles, and also in the eyes and the kidneys. So these are, as I can show you again, that's normal on top, gradually is getting blocked, and then almost 90% block. Okay, this is going to shock you now, because our beliefs, it has changed a lot. Okay, March 2020, 14th edition of the journal Circulation. Okay, researchers have discovered how diabetes, by driving inflammation and slowing blood flow, dramatically accelerates atherosclerosis. Experts once believed that atherosclerosis, or hardening of the arteries, develop when too much cholesterol clog arteries with fatty deposits called plaques. When blood vessels became completely blocked, heart attack and strokes occurred. This was that we also were told when we were medical students. But today, most agree that diabetes, high blood pressure, lack of exercise are the main cause of atherosclerosis, and not due to cholesterol as we believed in the past. When we were medical students, we were also told that testosterone was the main factor of causing prostate cancer. So in the past, if a person had high PSA level in the blood, they were castrated at the age of 45 to 60, young men, and they were impotent for life. So we were made to believe that for prostate cancer, testosterone was the main cause. Now we've been told in the last 15 years that it's not true. Now we've been told that testosterone prevents prostate cancer, and low testosterone level also cause metabolic syndrome. Can you imagine how much we changed now? So it's no longer to do with the testosterone. In fact, low testosterone level cause metabolic syndrome. Okay, what is metabolic syndrome? Okay, I shouldn't divert myself from blood pressure and this, but it's it means if you have low testosterone, you can have diabetes, you can have blood pressure, and also increase in lipids, and also hypothyroid. All these can affect your body. So every man at a certain age should check their testosterone levels. In people without diabetes, fast blood flow triggers an enzyme called ERK5, extra signal regulated kinase. Well, a few pages on that, but I'm just going to say only a few words about it because I don't want to confuse you. So this eventually prevents pro-inflammatory immune cells from damaging and causing inflammation of the blood vessel. In diabetes, in diabetic people, there is decrease in ERK5 enzyme level, therefore cannot prevent the inflammation of the blood vessel lining. Okay, I did show you the diagram before that like toxins, say like in a cigarette, or certain medicines, or very high blood pressure, or certain things that we take can cause damage to the blood vessels. These thin blood vessels, especially in kidneys, eyes, and heart, the lining inside is so thin, can be damaged, but continuously they are repaired by the immune system in the body. So if they didn't, will bleed to death. So what happens that if there's little damage in the blood, then this ERK stimulates other enzymes, and immediately they dilate the blood, and also platelets, they come and stop bleeding, and the monocytes comes on top of it, and increases. So it blocks the heart vessels. So I don't want to confuse you, but this ERK5 is found that in diabetes there is decrease in it, therefore the immune system or protecting the vessels disappears, and what happens that an atherosclerosis starts. So high blood pressure has three major effects on the cell lining, the blood vessels, as part of atherosclerosis or blockage. So what does it do if you have too much sugar in your blood? First of all, it slows the blood flow. Number two, it damages the endothelial lining of the blood vessel, which I showed you before, it's a very thin layer. And also, as I mentioned about ERK5, affects the inflammatory immune system. So with diabetes, you lose your protection. So what happens as a result? Diabetic causes inflammation, which is the main cause of atherosclerosis formation. So what are other things in the blood which sticks to this inflammation? Because once you're diabetic, you can't protect it. Fat is another food that we take and we eat it that can cause atherosclerosis. So fat is the source of energy, very good energy. A lot of energy comes from sugar and then the fat, but fat is the main energy in the body. Sorry, can I have some water? Fat is made of two kinds of small molecules, glycerol and fatty acids. And fats are made of long chains of carbon atoms. There are two types of fats, saturated fats and unsaturated fats. Well, what's the difference? Saturated fats is a type of fat in which the fatty acid chains have single bonds. They are saturated with hydrogen atoms. Because of their chemical structure, they have a solid structure. And saturated fat is a high source of energy. Well, unsaturated fats are liquid at room temperature. And unsaturated fats come mainly from plants, olive oil especially. And their chemical structure contain one or more double bonds. So we can divide this into three. Unsaturated fats, okay? We can say monosaturated ones, which is olive oil, rapeseed oil, avocado, nuts and seeds such as almonds, cashews, hazelnuts, peanut, pistachios, and spreads. And polyunsaturated ones are corn oil, sunflower oil, soya oil, because I eat them all, nuts and seeds like walnuts, pine nuts, sesame, sunflower seeds, oily fish such as herring, mackerel, pilchards, sardines, salmon, trout, fresh, tuna, salmon spread, and omega-3 oily fish, black cod. So these are good fats. So, I mean, body needs this. So unsaturated fats, we can divide into three: monosaturated, polysaturated, and omega-3, as I've shown you there. These are good for you. But saturated fats, especially the artificial, they are bad for you. So saturated fats divide into saturated, which is organic, comes from animal mainly, and trans, which are really artificial. I'll tell you how they're made. Anyway, so here we are, we can see it. Saturated fats are butter, hard cheese, whole milk, fatty meat, processed meat and meat products, certain biscuits and cakes, they don't last very long, cream, lard, dripping cheese, coconut and palm oil pastry. Trans fats are artificial fats, and they are made and they are put in certain food so they can last longer, but they are lethal. They are the one that cause a lot of trouble, and they are the one that can cause atherosclerosis, which are found in pastries, biscuits, cakes, and crackers, fried food, takeaways, hard margarines. And from now on, I'm not taking any biscuits with my tea anymore. I told my wife, I will just take little Pexamet or cakes that she makes. Okay, so much about fats. These are the main factors. Now, the main problem is this. Cholesterol. Cholesterol is different from fat. In the old days, we thought that cholesterol is a fat. Because it's fat, causes atherosclerosis. But because of new technology, electron microscope, and all this technology that differentiate, even get into DNA, RNA, everything, now we know more about these things that we didn't know before. So cholesterol is different from fat, and cholesterol is a building molecule. It is a major component of all cell membranes. It is an important essential molecule in making hormones, testosterone, progesterone, estrogen. So if you don't have enough cholesterol, then it can affect the men as well, their testosterone level. Anyway, fat-soluble vitamins like vitamin D is also made from the cholesterol. Cholesterol, which is made by the liver, is under the skin. When the sunshine goes, UV light goes, it converts into cholesterol 7 and then becomes vitamin D. So basically, we have cholesterol, a type of cholesterol under the skin. When you have the sun, it converts into vitamin D. So what is the function of vitamin D? You will laugh at me, but the function of the vitamin D is to transport calcium from the intestine to the body. So it is a calcium more important. But without vitamin D, you can't get your calcium into your cells. Vicious circle, but this is why we need vitamin D and calcium together. Okay, so also cholesterol produces bile acids to help digest food. It breaks certain fats, certain foods, so we can digest it. So cholesterol is a daily requirement, and 1 gram is produced by the liver every day. Rest of the cholesterol is produced from diet, from animal products, including meat, chicken, fish, eggs, and high-fat dairy products, saturated fats. Unlike fat, cholesterol cannot be exercised off, cannot be sweated out or burned for energy, whereas in fat, we can do all that. So it is mainly for building material. Smoking, I'm not going to talk so much about smoking because I can see some of the yawning. You might be falling asleep. So I'm going to say only a few words because it is part of the atherosclerosis. As we know, there are more than 4,000 chemicals in cigarettes, but the most important and dangerous ones are nicotine, carbon dioxide, and tar.
Monoxide.
And tar.
Carbon monoxide.
Carbon dioxide, carbon monoxide, both of them. So you can see all this in the cigarettes, which I think you know all that. But among all this, the tar contains a lot of toxic material as well. And also, every time you smoke, you increase the blood pressure because nicotine acts on the vessels, and this is normal vessel. Can you see it? Okay, I can't see, but you can see it. And nicotine stimulates the nerve ending, which is called acetylcholine nerve ending, and vessel shrinks like this. They become smaller in diameter. So what happens if you take a cigarette now and you do blood pressure in about 5 minutes, you will see that your blood pressure will go up because it constricts the blood vessels. This is why blood pressure goes up. This is one of the reasons that we don't smoke. Okay, because increasing blood sugar, also what happens, increases the carbon dioxide level. When you measure your oxygen level in the blood with oximeter, people that smoke, they have lower oxygen level. You know why? Because smoke, it's just you burn something. It says smoke, contains carbon monoxide, carbon dioxide. And when it comes to the exchange system in the lungs, carbon dioxide goes faster than oxygen. So carbon dioxide is absorbed more easily. Because it's absorbed easily, concentration goes up. Therefore, that's why in certain rooms in the old days, they used to use special paraffin heaters and not enough ventilation. And people in the morning died, they found dead because of the carbon dioxide and carbon dioxide, both poisoning, because it goes more than the oxygen. Hence, anyway, because increase in blood pressure then also causes atherosclerosis. What is atherosclerosis? As you mentioned, blockage of the vessels. But it doesn't contain only just fat it contains many things. You can see even blood pressure can affect it, and the blood flows slow down. Have you noticed? It slows down, and gradually it blocks. So let's talk about drug treatment. I know it's another topic I should talk to you some other day, but not all the blood pressure tablets act on the same place. Some act on the brain, have you got the note here? And we call centrally acting drugs, usually aldomet or methyl-dopa or clonidine. And some act on the kidneys, like ACE inhibitors, some beta blockers, some diuretics. The diuretics are obvious because what happens? Increase in blood pressure is also increased due to the volume of the blood, where because of the too much salt intake absorbs more water. So what we do, we give diuretics. Diuretics acts on the glomerular parts of the kidney and excretes the excess water and salt from the kidneys, and also some beta blockers also in the kidneys. So also in the heart, when we come to heart now, we are mainly beta blockers. What are the nerve endings, sympathetic and others, works on the heart. They produce noradrenaline. What do? Increase in blood pressure. How? It constricts the blood vessels. But beta blockers, what happens? It causes dilation because it acts on these, it stops these receptors and they don't constrict. So, but beta blockers, although it causes low blood pressure, they also decreases the increase in heart rate. So if you already have a decreased heart rate, you can use it because if it was so low, you might faint. And some of the blood medicine we take, they act directly on the arteries, and we call them vasodilators, with alpha blockers, calcium blockers like amlodipine, which is made, a lot of people use it, is quite good. All this also, as I said, you put under the tongue called glycerin trinitrate. That one causes dilatation, but it dilates all the blood vessels, unlike beta blocker, which acts on the heart only, or certainly on the kidney. So because you get vasodilation everywhere, you can faint as well. But it helps for the angina. So you tell people, when you take your GTN, don't move, sit down or lie down, so that you can open your heart blood vessels. Okay, I can see that everybody's falling asleep. So love your heart and look after it. I hope you liked it, and I did not bore you because it's a big topic. So I was told that I should answer some questions. Okay, I'm ready to answer your questions, Mehmet, but I can't hear anybody.
I can hear me now. I'm going to open everything.
No, I can hear you. All right.
But I asked the first question, and maybe someone already as well. First of all, we thank you very much for this, sparing your time and educating us on this. Can you hear me?
Yes, I can, yes.
You can, yeah. I'm sure everyone is happy. I'm a bit surprised.
Can I get rid of this picture? They can just see me, or just, I don't know how to do it.
No.
You don't see me, I can see you.
Okay.
But I will open everyone later. Just,
Okay.
I asked my question anyway.
Yeah.
How do you diagnose a heart attack, and what are the symptoms? I'm sure everyone else is going to ask for it. I'm going to open everyone and see if it's going to work. It's not going to, hopefully it's not going to bounce.
Deliberately, I left this out because it would take an hour, but what I'll do, I'll summarize. Okay.
Yeah.
Diagnosis of heart attack, okay?
Anyway.
First of all, it's a history. If they have, anybody has chest pain, you don't say, oh, you got heart attack. First of all, if they're diabetic, they're taking tablets, the age, you take history. But the main thing in history is shortness of breath, okay? If they're taking medication, and chest pain. So diagnosis from the history, then we do ECG and monitor. But when they come in sudden chest pain, you don't say you don't have it. You keep them minimum 16 hours because certain enzyme and certain activity doesn't show on monitor ECG until enzymes are raised. So you're staying in hospital minimum 16 hours to see it. And also there's new test now, blood test called troponin test. When in your heart attack, that means you have damage to the heart muscle. This is specific enzyme that released by the heart muscle called troponin, and we measure that. Even let's also take few hours to come to the blood. So you do your blood test in the beginning, and then you do also again after say 15, 16 hours, and to see if it raised. And you can do now echocardiography, which is more specialized. In A&E, you don't have this, but if you are suspecting heart attack, then cardiologists come, they do that. And if it's very severe, then you do angiography, cardiac catheterization, to see where is the problem, where is the obstruction. Now, you asked me about symptoms. Okay, usually, not always, sometimes we have silent heart attack, means it's very small heart attack. It's usually central chest pain. And my little one's arrived, I think. Gets in there. Central chest pain. Hello, Dedecik. Central chest pain, unrelated to taking deep breaths. Sometimes what happens when you have increase your chest expansion, expand your chest. Okay, breathing it, and you have pain. When you have pain, it's costochondrial pain. It's muscle pain. It's not a heart attack. So that's what we tell the patients. Take a deep breath in. Do you get the, oh yeah, where is it? And you touch them. When you touch, there's a pain, and you know it's not heart attack because for the pain of the heart, or angina or pain, you don't feel the pain. So first of all, you check the chest. And also what they say, I have central chest pain, and also it's like squeezing type, and it's burning and tightens. And also they definitely have shortness of breath, because sometimes edema occurs at the bottom of the lungs. And this pain is uncomfortable. You have sensations radiating to the left or right arms, both arms. Or you can have sudden nausea or vomiting. You feel dizzy, headaches, unusual fatigue and sweating, weakness and pain in both arms, not always left side. But also, I'd like to point out, we also get a silent heart attack, which we don't even notice, because what happens that if you have ischemic area at the bottom, only small part of the heart dies, or then body immediately repairs the area, stops the bleeding, and you don't get any symptoms. So we have two types of heart attack. One is silent one, which is rare, and the other one, I'll tell you, if you get it, you will know it.